Welcome. Today we'll review a case series on the Atlas Orthogonal chiropractic management of trigeminal neuralgia. This presentation summarizes the 2023 study by Dr. Joseph Ierano and Dr. Dennis Richards, published in the journal Explore. Trigeminal neuralgia is considered one of the most severe pain conditions known to medicine. It involves sudden, sharp, paroxysmal pain along the fifth cranial nerve, affecting the face. Affecting about 12 in 100,000 people, it can be triggered by the lightest touch, leading to severe anxiety, depression, and a significantly reduced quality of life. The condition is classified into three types: idiopathic, classical, and secondary. And because there are no conclusive diagnostic tests, diagnosis remains entirely clinical. Current medical options primarily rely on long-term anticonvulsants like carbamazepine, which carry significant side effects. Surgical options like microvascular decompression are invasive and carry their own risks and failure rates. Crucially, many classical cases show no evidence of neurovascular compression, leading to repeated calls in the literature for safer, non-surgical alternatives. Atlas Orthogonal, or AO, offers a precise, low-force upper cervical approach rooted in chiropractic's core principle that spinal subluxations may interfere with nervous system function. It uses a mechanical percussion instrument to deliver a highly specific adjustive thrust to the atlas vertebra. This vector is calculated using 3 röntgenometric lines drawn on cervical X-rays, aiming to restore orthogonal alignment and remove interference to the nervous system. This study followed 5 participants with chronic trigeminal neuralgia who had not found relief through medication or surgery. Over 8 weeks, they received up to 16 Atlas orthogonal adjustments, up to twice a week. Outcomes were measured using a 0 to 10 visual analog pain scale, alongside upper cervical palpation and X-ray analysis before and after each adjustment. The participants ranged in age from 52 to 72 and had suffered from chronic trigeminal neuralgia for anywhere from 2 to 18 years. All of them had previously tried and failed other interventions, including carbazepine, amitriptyline, and in one case, microvascular decompression surgery. The results were remarkable. 4 of the 5 patients reported reduced or completely eliminated trigeminal neuralgia pain. 2 experienced complete cessation of their pain. 3 patients were able to reduce their medication dosages. And importantly, there were 0 adverse events reported throughout the entire course of care. How does adjusting the neck relieve facial pain? The authors proposed 3 neurological hypotheses. First, mechanical stress on the spinal trigeminal nucleus, which extends down into the upper cervical spine at the level of the atlas. Second, traction on the dentate ligaments, causing cord distortion and nerve irritation. And third, decreased vertebral artery blood flow, causing ischemia of the trigeminal nerve. Each of these pathways links atlas subluxation directly to trigeminal neuralgia pain. While a case series cannot prove causation or generalize to the broader population, this study design is well suited for reporting on innovative interventions in real-world clinical settings. It builds on previous case reports and meets recognized rigor criteria. The authors acknowledge limitations, including a lack of randomization and the potential for practitioner bias, and they call for further, more rigorous research. In conclusion, Atlas orthogonal care produced meaningful relief for these chronic trigeminal neuralgia sufferers, offering a non-surgical, non-pharmacological option with no adverse events. Given the devastating toll this condition takes on patients' lives, these findings strongly support the need for larger-scale chiropractic research into trigeminal neuralgia. Thank you for watching. For the full study details, please refer to the original article in Explore, published in 2023. To learn more about Atlas Orthogonal Care, visit globalao.com.